Bulvinaka, and welcome back to our Cancer Awareness series. I'm your host, Rusila, and joining us today is Dr. Rao, our pathologist here at Oceania Hospitals. So he'll be helping us understand the role of pathology in cancer care, and you'll also get to know more about him and his journey through his years of experience.
Bulavinaka, good morning. I'm Dr. Rao, specialist pathologist from India. So I graduated in India in 2019. I have 6 years of experience. Now currently I'm working in Oceania Hospital as the head of the laboratories. So my role, what made me to enter into the pathology is when I was doing my undergraduation, I was curious about what are the causes, what is the pathogenesis, what is the mechanism of disease, and always I was curious to know what is under the microscope. So if I know the microscopy, the tissue, the sample, then I can diagnose the cancer. I can diagnose the cancer very early. That in that way I can help the patient for the early diagnosis and for their treatment plan.
Thank you. So we'll dive right into the question. So can you explain the role of a pathologist in cancer diagnosis and why pathology is so vital in a patient care's treatment?
Basically, there are so many varieties, like so many investigations, like biochemical investigations, radiological investigations for the diagnosis of the cancer. But they will give one idea, basic idea, whether it may be benign or it may be cancerous. But if you want to know the pathology is the tissue diagnosis, or pathology is the gold standard in terms of the diagnosis. Most of the clinicians, the specialist doctors, all are they will depend on the final diagnosis, which is based on the pathology only.
Thank you. So what happens in a biopsy or surgical specimen once it's collected, and how does it reach a cancer diagnosis in the lab?
So after immediately surgery, the surgeon, what they will do, they will put the biopsy in the formalin. First step, that is very important, because if you put the sample in the normal saline, tissue will be damaged. So in order to that, we should immediately after surgery, the surgeon will put the sample inside the formalin. Then within the formalin, that container will be transferred to the lab. In the lab, it will take 24 hours for the fixation. We'll keep it at the site for 24 hours. Then next day we'll process it. After the processing, our lab scientists, what they will do, they will process the tissue, they will cut it, they will stain it, and finally we'll have one slide. That slide I will keep under microscope. I will read the slide. So depending upon the findings, whether it is benign, that means non-cancerous, malignant, that is cancerous. If it is a malignancy, the type of malignancy, whether it is good or bad, or histological grade, and the stage. All these things we will know. This is the process from the sample collection to the reporting. So based on the report, surgeons will decide.
So how important is proper specimen handling and quality in ensuring accurate cancer results?
Sample handling is very important in case of cancer diagnosis and the histopathology diagnosis. Why? Because immediately after collection, after surgery, we should any histopathology sample, we should put it inside the formalin. If it is not done, or if the surgeon or anyone put the sample inside the normal saline, the tissue, there is no liquid for the fixation, tissue will be damaged, and the quality of the reports we can't process that sample. So always and the sample should be reached timely to the lab also. So the proper collection and the proper handling and the timely handover to the lab, and it should be in the proper liquid. So then only we'll be able to give the proper report. So that is the reason why proper handling of the sample is very important. So before what we do, before the grossing, we'll check all the labels, whether the same patient or not, the tissue from the same patient or not, and the tissue is there inside the formalin or within the normal saline. All these things we'll see before the specimen processing.
Thank you. So on to our final question. What kind of advanced or molecular tests can be done on cancer specimens, and how do they help guide treatment?
So this is a good question, because these days incidence of the breast cancers are increasing in young females. So any female with a history of breast cancers in their family, like mother, sister, they should go for a molecular testing. There are some molecular testing available, though like there are BRCA, there are some genes. Those genes are there in the both males and females, but the names of the genes are BRCA, BRCA1 and 2. These genes are there in both males and females, but the breast cancers and ovarian cancers are associated with if there is a mutation, if there is a problem in the gene, that gene mutation will cause the cancers in the females. The problem with these mutations are these patients who are having these mutations, they present very early, and along with not only early presentation, these mutations are associated with poor prognosis. There are some tests which are available to know the mutation of these genes. So currently in our Oceania, we are testing these BRCA genes. So if the BRCA genes are positive, then the patient should go for the genetic counseling. So there are some doctors, they will give the genetic counseling. Based on that, so we will know when to do this BRCA gene testing. Usually after 20 years. After 20 years, if for example there is a family history, then after the 20 years, if you go for BRCA testing, if it is positive, then once the female, she completed her family, she can go for prophylactic mastectomy to prevent the breast cancer in future.
Okay, thank you. So that ends another session of our cancer awareness series. Thank you again, Dr. Rao, for giving us an insight into how pathology plays a role in cancer care. And if you've liked this session, if you found it inspiring or informative, please don't forget to press that like, share, and follow button. Until next time, stay safe and take care. Naka.